Good morning. You're waking up with Kim and Dana Wagner for top stories and weather. And Chopper Tom Hawley with Las Vegas Valley traffic. This is Wake Up with the Wagners on News 3, the only morning newscast that gives you a jump on the day's news.
It's 6:40 now, and 1 in 8 women will be diagnosed with breast cancer. Finding out you have it is shocking. Finding out when you're pregnant, emotionally devastating. Denise Speidel is live in studio with us now. And Denise, I would have to imagine too, when a mom finds this out, she's wondering how the chemotherapy is going to do with her unborn child, how that baby's going to react to the poison, essentially.
Doctors tell me it's the first question that most mothers ask, but actually doctors now know that most babies do just fine with chemo after the first trimester, and baby Zoe, who we're going to show you, is a perfect example. And this is very cool. A brand new study just out also shows babies like Zoe not only tolerate it well, but they actually may help save their mother's life.
Baby Zoe is just about a month old, but she's already endured the rigors of chemotherapy. It began last April when Candace was 15 weeks pregnant.
I had actually felt a little lump on my breast just before I came in for my OB appointment.
This was breast cancer, and up until a decade ago, doctors often urged women to wait until birth to begin treatment or consider an abortion. But researchers then offered evidence now commonly practiced among doctors like perinatologist Bohman. After 12 weeks, a fetus can handle chemo.
The best way to look at chemotherapy is it's poison, and the cancer cells are more susceptible to those poisons than normal cells. The baby has normal cells.
Oncologist Dr. Mary Ann Allison treats many younger women with breast cancer and says moms do better in battle.
As far as handling the chemo, my pregnant ladies usually do better. I know they do better on their blood counts because their bone marrows are really in good shape.
All that bone marrow and blood is because of the baby, but it may also help beat the cancer. A brand new study states after 5 years, 74% of women diagnosed during pregnancy were still alive, compared to 56% not pregnant at the time. Candace will continue her fight for the next year, flanked by her husband and now 3 kids. She may be lucky on 2 fronts. She was pregnant, but mainly she found the lump and followed up right away.
If you feel something, even if you think it's nothing, like I did, I thought it was nothing, you should definitely follow up.
Yeah, don't let it go, because the key to cure is early.
If you need more reinforcement to do your exams, Candace doesn't even have breast cancer running in her family, so everybody needs to be doing this. She says that if you're doing your exam, a good rule of thumb, a good metaphor almost, look for something that feels about the size and the hardness of a marble. And Kim, I want to point out, speaking of cool studies, the Nevada Cancer Institute tomorrow is opening a rehab and exercise facility. They're going to be studying how exercise affects breast cancer patients as they're diagnosed and going through treatment.
Wow, that's all I have to say. Excellent job on the story, and thank you, because I mean, the whole early detection part, and then on top of it with the survival rates with expectant moms, amazing stuff. Denise, thank you.
Sure.
All right, let's check out the traffic situation with Tom Hawley.